Well, as well as our immediate priority to invest record sums in the NHS to cut waiting lists, I want to make sure that the NHS is fit for the future. And today's announcement, expansion of lung cancer screening, is a good example of that. Lung cancer is the leading cause of death by cancer in the UK. And we know that if you catch it early, then you can much more improve the chance of people surviving it. The pilot schemes that we've been running, people will have seen lung trucks in supermarket car parks like the one we're in today, make an enormous difference. And that's why we will roll it out nationally, targeting those adults at risk, and in doing so, save thousands of people's lives. It's a good example of doing the right thing for the long-term benefit of the NHS and for patients everywhere.
But frankly, the NHS is not in a good state. There's a King's Fund report out today which says effectively that our outcomes amongst comparable countries is not great. We're 16th and 18th in terms of preventable and treatable countries in terms of care and mortality rates. It's not a great record. You've been in power for 13 years now. The NHS seems to be going in the wrong direction.
Well, one of my 5 priorities is to cut NHS waiting lists. That's why we've put record sums into the NHS since I became Prime Minister, with record numbers of doctors, nurses, and new ways of doing things which are starting to make a difference, and we're seeing that in the numbers. But of course there's work to do. But we also need to make the decisions that will modernise the NHS for the long term. Today's example, rolling out lung cancer screening, will really help improve survival rates for lung cancer, something where we are behind other countries, but today's announcement will help fix that. But also later this week, we'll be making a really important announcement. For the first time in its history, the NHS will have a long-term workforce plan to make sure that we hire the doctors, the nurses, and all the other GPs and medical staff that we need for the long term, reduce our reliance on foreign-trained clinical staff. Those are the right long-term decisions for the NHS, and that's what I'm interested in doing.
Talking about that, I've got friends who are doctors and nurses who are moving to Australia and Canada. They're leaving the National Health Service, trained here. Why are they doing that? Because they're getting paid more. Why are you not prepared to pay junior doctors and other NHS staff more?
I think everyone can see the economic context that we're in, with inflation higher than we'd like it, and it's important that in that context the government makes the right and responsible decisions on things like public sector pay. I'm actually very pleased that over 1 million NHS workers, represented by half a dozen unions, accepted the government's pay offer, and I'm very grateful to them for that and for the incredible work they're doing. It's very disappointing that the junior doctors have taken the decision that they have done. Over 500,000 people's treatments have already been disrupted. I don't think anyone wants to see that carry on. It's just going to make it harder to bring waiting lists down, and I think people need to recognise the economic context we're in, and I'm going to make the decisions that are the right ones for the country. That's not always easy. People may not like that, but those are the right things for everybody, that we get a grip of inflation, and that means the government not excessively borrowing too much money and being responsible with public sector pay settlements. That's what I'm going to do, and I would urge everyone to see that that's the right course of action.
Just before we get on to other subjects, just on that specifically, because the unions dispute this, are you saying that public sector pay is a major driver of inflation? They say it's not.
Well, government borrowing is something that would make inflation worse. So the government has to make priorities and decisions about where best to target our resources. And that's why when it comes to public sector pay, we need to be fair, but we need to be responsible as well. And we've done that. We've reached agreement with over half a dozen NHS unions, representing over 1 million workers, who accepted the government's offer, and I'm very grateful to them for that. The junior doctors are asking for, I think, a 35% pay increase. I think everyone can see that that's completely unreasonable, given the context we're in, and it's important that we bring inflation down. Over 500,000 people's treatments have already been disrupted. That's not something I want to see continue. I want to see us getting the waiting list down. We're already investing record sums in the NHS, so no one can say that we're not putting the money in, but it's important that we don't make the inflation situation worse, and it's important we prioritise the things that are right. That's why later this week we'll be making an announcement that expands the number of doctors, nurses, GPs that we train. Those are the right things to do. I'm making the decisions that are right for the long term, and that's what I'm going to continue doing.